from the National Institute on Alcohol Abuse and Alcoholism. Alcohol's effects on health. Research-based information on drinking and its impact. The cycle of alcohol addiction. Alcohol addiction is a chronic relapsing disorder associated with compulsive alcohol drinking, a loss of control over intake, and the emergence of a negative emotional state when alcohol is no longer available. Alcohol use disorder, AUD, is a condition characterized by an impaired ability to stop or control alcohol use despite adverse social, occupational, or health consequences. It is a spectrum disorder and can be mild, moderate, or severe, and encompasses the conditions that some people refer to as alcohol abuse, alcohol dependence, or the colloquial term alcoholism. Alcohol addiction refers to the moderate to severe end of the AUD spectrum. How does addiction develop in the brain? Binge/intoxication, negative affect/withdrawal, preoccupational anticipation, back to binge/intoxication. Alcohol, like other drugs, has a powerful effect on the brain, producing pleasurable feelings and blunting negative feelings. These feelings can motivate some people to drink alcohol again and again, despite possible risks to their health and well-being. For example, research shows that over time, drinking to cope with stress, while it may provide temporary relief from emotional discomfort, tends to enhance negative emotional states between bouts of alcohol consumption. These changes can motivate further drinking and cause an individual to become stuck in an unhealthy cycle of alcohol consumption. Footnote 1, footnote 2. Excuse me. As individuals continue to drink alcohol over time, progressive changes may occur in the structure and function of their brains. These changes can comprise brain function and drive the transition from controlled occasional use to chronic misuse, which can be difficult to control. The changes can endure long after a person stops consuming alcohol and can contribute to relapse in drinking. Stages of the addiction cycle. Addiction can be framed as a repeating cycle with 3 stages. Each stage is linked to and feeds on the others. These stages primarily involve 3 domains: incentive, salience, negative emotional states, and executive function. The domains are reflected in 3 key regions of the brain: the basal ganglia, the extended amygdala, and the prefrontal cortex, respectively.
Basal ganglia.
A person may go through this 3-stage cycle over the course of weeks or months, or progress through it several times in a day. Footnote 3, footnote 4, and footnote 5. Note also that a person can enter a cycle of addiction at any one of the following stages. 1. Binge/intoxication stage. Reward, incentive, salience, and pathological habits. During this stage, a person experiences the rewarding effects of alcohol, such as euphoria, the reduction of anxiety, and the easing of social interactions. Repeated activation of the basal ganglia's reward system reinforces alcohol drinking behavior, increasing the likelihood of repeated consumption. The basal ganglia play an important role in motivation as well as in the formation of habits and other routine behaviors. This repeated activation of the basal ganglia also ultimately triggers changes in the way a person responds to stimuli associated with drinking alcohol, such as specific people, places, or alcohol-associated cues, such as certain glassware or images or descriptions of drinking. Over time, these stimuli can trigger powerful urges to drink alcohol. Repeated alcohol consumption also results in changes in the basal ganglia that lead to habit formation, ultimately contributing to compulsive use. 2. Negative effect/withdrawal stage. Reward deficits and stress surfeit. When a person who is addicted to alcohol stops drinking, they experience withdrawal symptoms, or symptoms that are opposite to the positive effects of alcohol that are experienced when drinking it. These symptoms can be physical, in parentheses, sleep disturbances, pain, feelings of illness, in parentheses, and emotional, dysphoria, irritability, anxiety, and emotional pain. The negative feelings associated with alcohol withdrawal are thought to come from two main sources. First, a diminished activation in the reward systems, or a reward deficit of the basal ganglia makes it difficult for people to experience the pleasures of everyday living. Second, an increased activation of the brain's stress systems, or a stress surfeit in the extended amygdala contributes to anxiety, irritability, and unease. At this stage, a person no longer drinks alcohol for the pleasurable effects, quote, high, end quote, but rather to escape the, quote, low, end quote, feelings which chronic alcohol misuse has contributed. 3. Preoccupation/anticipation stage. Craving, impulsivity, and executive function. This is the stage which an individual seeks alcohol again after a period of abstinence. A person becomes preoccupied with alcohol and how to get more of it, and looks forward to the next time he or she will consume it. The prefrontal cortex, an area of the brain responsible for executive function, including the ability to organize thoughts and activities, prioritize tasks, manage time, and make decisions, is compromised in people experiencing alcohol addiction. As a result, this area of the brain plays a key role in this stage. Hyperkataphia.
Hyperkataphia.
Hyperkataphia is a word that can be used to describe the negative emotional state associated with drug withdrawal. This overactive negative emotional state is hypothesized to drive the consumption of alcohol to find relief from this emotional state, and it may be caused by profound changes in the brain reward and stress systems. Why should we be concerned about AUD and alcohol addiction? Alcohol consumption is linked to many health and social consequences, including interference with personal relationships, heart and liver diseases, cancers, motor vehicle collisions, and other accidents, alcohol overdose, violence, homicide, and suicide. If a person has AUD, particularly if it is moderate to severe and involves alcohol addiction, they are more likely to regularly consume alcohol in levels associated with these effects on health. Young people are especially at risk for AUD. Using alcohol during adolescence, from preteens to mid-20s, may affect brain development, making it more likely that they will be diagnosed with AUD later in life. However, most people with AUD, no matter their age or the severity of their alcohol problems, can benefit from treatment with behavioral health therapies, medications, or both. And then it says, for more information about how alcohol affects the brain, please visit Alcohol and the Brain. And for more information about available evidence-based treatments for AUD, please visit the NIAAA Alcohol Treatment Navigator. And then there are the references, footnotes, published 2021. We'll go to Alcohol and the Brain. Alcohol and the Brain, an overview. And this image here is a diffusion tensor imaging DTI of fiber tracts in the brain of a 58-year-old man with alcohol use disorder. DTI maps white matter pathways in a living brain. Image courtesy of doctors Adolf
Pfefferbaum.
and Edith V. Sullivan. Alcohol interferes with the brain's communication pathways and can affect the way the brain looks and works. Alcohol makes it harder for the brain areas controlling balance, memory, speech, and judgment to do their jobs, resulting in a higher likelihood of injuries and other negative outcomes. Long-term heavy drinking causes alterations in the neurons, such as reductions in their size. Below are a few key topics related to alcohol and the brain. The adolescent brain. Adolescent brains are more vulnerable to the negative effects of alcohol than adult brains. Misuse of alcohol during adolescence can alter brain development, potentially resulting in long-lasting changes in brain structure and function. Alcohol-induced blackouts. Alcohol misuse can cause alcohol-induced blackouts. Blackouts are gaps in a person's memory of events that occurred while they were intoxicated. These gaps happen when a person drinks enough alcohol that it temporarily blocks the transfer of memories from short-term to long-term storage, known as memory consolidation, in a brain area called the hippocampus. Alcohol overdose. Continuing to drink despite clear signs of significant impairment can result in an alcohol overdose. An alcohol overdose occurs when there is so much alcohol in the bloodstream that areas of the brain controlling basic life support functions, such as breathing, heart rate, and temperature control, begin to shut down. Temperature, excuse me, Symptoms of alcohol overdose, including mental confusion, difficulty remaining conscious, vomiting, seizure, trouble breathing, slow heart rate, clammy skin, dulled responses, such as no gag reflex, which prevents choking, and extremely low body temperature. Alcohol overdose can lead to permanent brain damage or death. Alcohol use disorder. As individuals continue to drink alcohol over time, progressive changes can occur in the structure and function of their brains. These changes can comprise brain function and drive the transition from controlled, occasional use to chronic misuse, which can be difficult to control and lead to alcohol use disorder, AUD. Individuals with moderate to severe AUD may enter a cycle of alcohol addiction. The extent of the brain's ability to return to normal following long-term sobriety is not fully understood, but a growing number of studies indicate that at least some AUD-induced brain changes and the changes in thinking, feeling, and behaving that accompany them can improve and possibly reverse with months of abstinence from drinking. More detail about the neuroscience of AUD is provided in the Neuroscience, the Brain in Addiction and Recovery section of the Healthcare Professionals Core Resource on Alcohol. Prenatal alcohol exposure. Prenatal alcohol exposure can cause brain damage, leading to a range of developmental, cognitive, and behavioral problems, which can appear at any time during childhood. Alcohol can disrupt fetal development at any age during a pregnancy, including at the earliest stages before a woman knows she is pregnant. For more information about alcohol and brain health, please visit the Alcohol and the Brain topic page. Updated December 2025. niaaa.nih.gov, an official website of the National Institutes of Health and the National Institute on Alcohol Abuse and Alcoholism. And that'll be it for this video.